Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist who practices independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
Great to have you with us on this dimension of House Call. Thank you for inviting us into your home or wherever you might be, on television or on radio or on CD or DVD. We're just pleased that you're with us. Fellowship of the Great Physician sponsors this program, and even though it's more natural health oriented, the Fellowship of the Great Physician is a non-denominational ministry where we believe that Jesus is the great physician. So we welcome anyone, be they denominational or non-denominational, to join our fellowship. We meet on Thursday evenings in Roseville, Minnesota, and there's no charge for our classes. We have people who love the Lord and who believe in the supernatural gifts of the Holy Spirit. We operate and function in all of those by the Lord's anointing. And if you have any health problem, be it physical, mental, we invite you to attend. And we have a wonderful time of worship, and then we have a wonderful time of teaching and a time of ministry. So you're always welcome. And what we're doing here in this series is part 2, You and Your Hormones, and it relates to all males and females of all different age groups. And if you weren't with us in part 1, Dr. Richard Jensen is going to do a review of some of the symptoms related to female and male hormone imbalances, and then we're going to launch off into some new material. Dr. Jensen, please.
Thank you, Dr. Lala. Well, here's the thing is that if you did miss part 1, it is available for streaming video off of our website, and that's at www.housecalltv.com. Go to where and how to view, and there will be a link there to the various programs, and I would direct you towards the hormone programs. But for those of you who do not have access to the internet, we're going to do a quick review for you at this time. And so what we're going to do is come up with this slide with the hormone axis of influence. And basically what the hormone axis of influence is if you see the diagram on the left side of your screen, there's some different colors on there which show you the placement of these hormone centers. And the first thing that it starts out with is the thalamus, which is right in the center of the brain. And it's a very, very important area of the brain which controls things from pain sensation to consciousness to in this case, it shows where it's the beginning influence that turns on the hormone system. So we start with the thalamus, and then from there it goes to the hypothalamus, which is just hypo means below, and so we're looking at just below the hypothalamus, and these release certain hormone releasing type signals, which then go to the particular hormones, in this case, would be the adrenal glands, but it could be any kind of endocrine gland in the body, such as the thyroid, the adrenals, what have you. Then the adrenals, which you see is in yellow, and you see that that's centrally located in the body so that it can then secrete, this hormone reaches all of the body fairly soon. The ovaries also would be an endocrine gland. In this case, it gives off your sex hormones. Or the testicles would do also for if it was a male. But what we're finding is, the picture being a female, hormones have the influence that, hey, it changes boys to men and girls to women. And what we find is the adrenal gland and the ovaries are quite well interrelated with the sex hormones, because in your sex hormones, 80% of those are in women secreted by the ovaries. For women, 20% of those sex hormones are secreted by the adrenals. And this becomes very important as we go through menopause, because what happens is as the ovaries start to drop back, the kidneys start to take over to make that more of a smooth transition. So many women who are not having a smooth transition here will end up It may be due to, say, adrenal exhaustion, and therefore can be helped by giving those raw materials for the adrenals to work a little bit more efficiently. And so that's where some of the therapies can go from there. Ovaries, then next it goes to the hormone-sensitive tissues, because these hormones are basically like keys, and they go to certain locks, and those are the receptors for those, and those receptors are found in those tissues that are to be most sensitive to it. So in the case of female hormones, when they're going through their menstrual period, the hormones have basically revved up the body to be ready to support another body or a child through that. So it's a thickening of the uterus wall. It makes a lot of breast changes, all those kinds of things that start to go on. So then what we find is when we're looking here at the hormone-sensitive tissues, that's the end result of where those hormones are going to. Now, we're going to go into symptoms of hormone imbalance. And we're picking on the females first here. Men, you'll get your chance. First of all, symptoms of hormone imbalance in females can lead to such things as alcoholism, anorexia, anxiety, arthritis, bulimia, back problems, cancer. We always hear about hormone-sensitive tissues having that can create cancer in there. Fatigue, depression, diabetes, dizziness, and drug addictions. And then also, to continue that list, there's dysmenorrhea, endometriosis, gastritis, hair loss, heart disease, hypoglycemia, indigestion, infertility, insomnia, lupus, fibrocystic breast and uterine disease. And these things, if you want more information on this, remember, please go to our first program on this where we spent more time on this particular list. Symptoms of hormone imbalances in females continued. It's menopause problems, obesity, menstrual cramps, mood swings, neuropathy, osteoporosis, premenstrual syndrome, and menstrual spotting. And remember, we put up these lists so that if one or more of you would see that you are suffering from these types of things and you're getting to a point in menopause or just near your menstrual cycle, that you would be able to recognize these things and say, hey, this might be a solution for me. How about male hormone imbalances? Well, that would also affect the male, as in depression, back problems, fatigue, insomnia, heart disease, mood swings, diabetes, anger, anxiety, aggressiveness, again, alcoholism, and low libido. And so what we're going to do now is go into more of the nervous control of these hormone-generating axis, and for that, we'll turn it over to my esteemed colleague, Dr. Jerry Lala.
Thank you. Certainly, we're licensed as doctors of chiropractic, and when we're in the clinic, we wear our white jacket and our stethoscope and do things that chiropractors are licensed to do under the scope of practice. But our approach, even though we see people that have been involved in on-the-job injuries and car accidents and things of that nature, we look at it more from a preventative healthcare practice than chasing symptoms around. And we're largely diagnostic-based rather than just treating people based on symptoms, but trying to really find the cause of symptoms. Now, hormones have two different varieties. They're called exocrine and endocrine glands, and Dr. Jensen has been talking about those, but the hormones are also affected by our brain and our nervous system. And so we're going to bring up a slide here that kind of depicts that a little bit for you. As you can see here, at the top of the screen is the brain, and then we see the spine and the spinal cord, and then out to the front on your far left, we see the various organs that the brain and spinal cord affect. So nothing lives successfully in the body without proper nerve energy going to it. And that includes blood as well, and lymphatic drainage. And so, but the spine is really the switchboard in the nervous system, and the brain would be like an electrical generator coming at the main power plant. Then you have the big main power line coming down through the spinal cord, and then the vertebra actually acts like switchboards to the nervous system. When we're talking about hormones, they're greatly influenced by our brain. They're greatly influenced by how the condition of the spine. So when people come to us with hormone problems, certainly we want to look at, for example, a blood analysis and a 24-hour urine hormone analysis, but we also want to look at their spine to make sure that the areas of the spine that dramatically and predominantly affect the ovaries and the testes and all of the other endocrine and exocrine glands, that they're in alignment. And so we can then look at another slide now, and we'll see an example. If we took a section of vertebra here, we see it A, B, C, D, E, and F on the far left of your screen. And A is representing a normal looking disc or a normal appearing disc. B represents a hole called the intervertebral foramina that's made up by the vertebra above and the vertebra below, as we're circling that for you. And then we see below there the body of the vertebra, and now we see that yellow thing there. There's the body of the vertebra, and the yellow thing there would represent the nerve coming out from those intervertebral foramina. They're like windows that control the nerves coming from the spinal cord, as well as arteries, veins, lymphatics, and acupuncture meridians. Now, when we look at D, we see that that vertebra has lost its normal juxtaposition when you compare it to the vertebra above and the vertebra below. And we also see then that it's squeezing down on the disc when we look at E, kind of wedging on the disc. And so the disc then loses its normal shape, thickness and size and contour. And then if we look at F, we see what would typically happen to the nerves, arteries, and veins, lymphatics, and acupuncture meridians. They would be compressed coming out of the spinal cord. Now, if it happens to be those nerves, arteries, and veins and lymphatics that are going out to the testes in the male, or to the ovaries in the female, or to the thyroid gland, or the hypothalamus or thalamus, the pituitary glands up in the brain, then that hormones that are affected by those nerves and blood supply are going to be adversely affected. So that's why we look not just at the analysis of a male or female's hormones, but at their spine as well. And again, this is called due diligence. Due diligence meaning that I can have one finger that's not functioning well, but I should really look at it and examine it in relationship to the other fingers, the carpal bones in my wrist, and all the way back up here to my neck, because that's where the nerve supply comes from the spinal cord down into the brachial plexus, down into here. And so what's happening in many practitioners' offices today is they're just looking at the particular symptom. And so they're throwing a drug at it, or maybe giving a chiropractic adjustment, or going to a massage therapist, or maybe they're going to somebody who's practicing nutrition but doesn't look at the spine, or that is practicing nutrition without doing credible science-based diagnostic tests, or going to somebody who is practicing nutrition and who's just saying, well, I'm going to shotgun you with these natural hormones or these synthetic hormones. Well, you don't know. If you don't see, then you can't manage. So when I look inside, for example, at a blood test or a hormone test, I can see what's going on inside of that body just as much as we don't treat people's spines without x-rays. Because the x-ray is like a blueprint. It tells us what the condition is inside of that spine, and it also tells me, can I help it? How much might I help it? Or maybe it's not really within the realm of my practice. Is that right, Dr. Jensen?
Absolutely. And so what we're going to look at is, since the subject is hormones, is to see about the transportation of hormones. And so if we look through here with hormones being transported, they're transported through a hormone blood transport system. And this transport blood system is utilized basically using the proteins in the blood, and such as one of those hormones is cortisol. And it's combined with globulin, one of those proteins in the blood. 94% is bound and transported, and 6% is free or unbound within your bloodstream. Now, another one of these hormones is called aldosterone, and it combines with the plasma protein And whereas 50% is free and 50% of it is bound. And then there's what happens is it allows that the location on the cells are related to specific activities. So where it is bound onto the cells depends on what happens or what is unlocked or what expression is opened up from those hormones.
And this would be one of the reasons, like we do chem screens and CBC blood counts, and one of the markers that we always want to look at is globulin, because it
Right.
has a relationship to not only gamma globulin for resistance against disease, but again, this hormone transport system. So if somebody's not doing a blood test, or if they're doing a very microscopic or a limited blood test and it doesn't include the globulin, an error can be made there, right?
Absolutely, and generally when you're doing these blood tests, a lot of times, if it's being, if the doctor isn't ordering a complete scan of your different systems, because all these things are interrelated. And so when you're looking at albumin and globulin, how that's being produced in the liver, and you can have a switch of ratios between that, which we know as an ominous sign. You're not seeing exactly what's going on with them. You know, a lot of times we get in blood reports that somebody brings in from somebody else, and all that is checking is a great deal is just cholesterol.
Or triglycerides.
Or triglycerides, or blood sugar.
Yeah, that's about it.
But it doesn't go into any of the enzymes.
That's right.
Or any of the proteins.
And that's significant because, as you said here, cortisol is combined with globulin. 94% is transported and bound, and 6% is free. So it's so important to know that in the blood test, isn't it?
Absolutely, absolutely. And so then we also look at hormone receptors. And hormone receptors are basically those things in which allow these hormones to have activity. It carries the signal, or it actually activates the signal of the hormone inside the cell. And many of these hormones, some of them are protein-based and have to connect with things on the outside of the cell membrane. Others are fat-soluble and move right through the membrane to a receptor that's inside the cell, and then that receptor moves into the nucleus and unlocks your DNA.
So we could almost say it's like a magnet. They're like magnets. They just attract.
Absolutely, absolutely. So let's look at hormone receptors. They're affected by the sympathetic and parasympathetic nervous systems.
And there's that issue that we just talked about, going to a spinal specialist who understands the spine, because the spine controls that sympathetic and parasympathetic nervous system.
Right, right. Well, if the organ isn't working correctly, such as if somebody's having trouble getting pregnant, it may be that the nerves going to the ovaries just aren't working that well, and the communication is not there, so that if the communication isn't there, that's not working or functioning to its optimum. So the hormone transmitter binds to the cell receptor. Like I said, either that can be out on the outside of the cell or inside of the cell. Sometimes there's overstimulation that results in excessive tissue growth. When you look at hormones such as estrogen, estrogen is an anabolic steroid. An anabolic steroid always builds up. And when you're looking at if you're female and you have water retention, why is that? Because what estrogen does is it builds up proteins in the body, in the extracellular fluid, and it pulls more water into that area, causing you to bloat. So it's how the balance is as to how well your body is reacting to these hormones. Dr. Lala, you have something
You're
you
going
want
to
to
talk about the example like the sodium or ion channel pumps?
Sure. Sodium and or ion channel pumps become open, allowing for a rapid influx of calcium or sodium ions into a cell, causing depolarization. Potassium channels are opened, allowing potassium ions to diffuse out of the cell, which inhibits a cell because electropositive ions create hypernegativity inside the cell. Basically, what we're looking at here is when a cell is activated. Let's talk about a nervous cell. A lot of times what happens is when these things are activated, it's all due to electric charges. Now, on the outside of the cell, there are channels that will open and shut, allowing the passage of these fluids in. Now, sodium has a positive charge, or actually a negative charge, and what happens is when it opens, all the sodium can influx straight into the cell. And in order to allow that cell to relax, what will happen is it'll open and let out all this potassium to allow the cell to relax, and then to recharge, you use the calcium.
Now, is the DNA or the RNA affected by these hormone transmitters and these cell binders?
Well, certainly, since we talked about earlier with the hormones, when they, particularly the fat-soluble ones that pass right through the membrane, they connect themselves to a receptor, and the receptor, due to, when a receptor, let's say the receptor looks like a flat palm, when the hormone comes in and connects to it, because of the electrical charges, this will change form. And when that happens, that makes it so that it can then go in and unlock something else. And generally what it'll do is when the hormone enters the cell, the receptors then migrate into the nucleus of the cell, and then it changes configuration, which then unlocks a portion of the DNA. And when that portion of the DNA gets unlocked, then it starts to get transcribed and changes the proteins inside the cell, changing the function of the cell, literally changing the cell into something else so that it can react.
So this would be then what's happening in cancer, for example, or even benign fibrocytic growths and things of that nature.
Right, right. And it can have positive and negative effects depending upon how it's being stimulated. So then, let's go on to enzymes and hormones, Dr. Lala.
Well, people hear a great deal about enzymes. What are they? And they are related to our hormone system as well. So enzymes are complex organic compounds secreted by specific cells. They require, for normal health, vitamins and minerals and cofactors, including now carbohydrates, proteins, fats, and herbs. They are like sparks to gasoline, so other cells then are influenced by enzymes, which affect, again, the membranes of cells. So it's just not the hormones that affect the membranes of the cells, but also the enzymes. Enzymes, as I said, are complex organic compounds secreted by specific cells, now capable of causing change in other cells. Now, they require vitamins and minerals and cofactors, and I said fats, carbohydrates, proteins, and for their efficient catalytic function, and they act like a spark to gasoline. So let's look at some examples of some enzymes that people have some understanding of or have heard of. There are pancreatic enzymes, and that includes insulin as an enzyme. Then there's pancreatic lipase, which metabolizes fats. There's pancreatic protease, which metabolizes protein. And there's pancreatic amylase, which metabolizes carbohydrates or sugars. Now, let's understand a little bit more about these hormone receptors that Dr. Jensen was talking about. What we have on the screen for you is some examples of them. There's acetylcholine. That's affected by muscarinic and nicotinic. There's androgenic, which are alpha and beta, or beta 1 and beta 2. Another one is norepinephrine. By the way, these are all neurotransmitters. They excite the alpha receptors in cells. And then there's epinephrine, which is both alpha and beta receptors. Now let's talk a little bit more about alpha beta estrogen receptors, all right, because some of you people listening or watching the program are taking drugs that the doctor is prescribed to block these hormones from affecting the receptors. Now, alpha and beta receptors are primarily affect the central nervous system. So every time that you go to the chiropractor and he or she manipulates your spine, they are affecting your central nervous system, which in turn includes affecting those alpha and beta receptors. Now, alpha estrogen sensitive receptors, where are they located? They're primarily located in the uterus, in the breast, and the liver. Now, where are the primary sites of the beta estrogen sensitive receptors? Those tissues include your blood vessels, your liver, your lungs, your intestines, prostate, genitourinary tract, bones, and testes. Now, let's talk a little bit more about them, the estrogen receptors and your DNA, desoxyribonucleic acid. All right, alpha and beta estrogen receptors have a DNA, and Dr. Jensen has discussed this briefly. They have a DNA binding capacity. They act as genetic control of cells. The DNA structure of certain cells becomes altered and diseases set in. So, in many diseases, hormones have been found out of control for long periods of time and eventually cause the DNA structure of your cells or of certain cells to become altered and diseases set in. Now, when the estrogen and androgen receptor cells are empty, they attract their receptive estrogens and androgens being male hormones, and begin activating or deactivating cellular activity. So even though I am a male, I have predominantly androgenic dominance in my body, but as a male, all males have estrogens in their body, just as much as females are predominantly estrogenic, but they have androgenic cells in their body as well. And it's when they get out of balance that we get into the causing of disease. Now, very often this takes some period of time for the symptoms to develop. So if we don't see, we can't manage. If I don't look at a hormone analysis, I don't know what those hormones are doing. I can make a natural prescription, or a medical doctor could prescribe hormones for it based on symptoms, but the true fact is that if I can say, well, I don't know if my car needs oil or not. I think I'll put a quart of oil in without checking the dipstick. Or if you didn't have some form of needle or readout on if your car needed gas, you say, well, I've been driving for a while, I think I might need some gas. Well, it's no different than if you go and throw synthetic hormones at a body, or from preventative health care practitioners ourselves, if we start throwing natural estrogenic or phytoestrogenic chemicals at that body, we're endangering that individual. Now, that individual may not show those adverse reactions initially, but over a period of time they will, correct?
Correct.
All right, so now, altered receptors, altered estrogen and androgen receptors then over-attract. They become excessively receptive to androgens or estrogens. They begin over-activating and or deactivating cells, resulting in what? Things like cancer, diabetes, and osteoporosis. Now, Dr. Jensen is going to spend a little bit of time talking about xenobiotics.
Xenobiotics are basically artificial hormones. They are chemicals that have been released into the environment that will have sort of hormone type of reactions with our body. They're attracted to the beta and alpha sensitive receptors. They're basically, because of their configuration, they look a lot like or carry the same electronic signature as some of these other hormones, and therefore react with them. It predisposes people to altered functions in the cells, leading to disease, and one of the most common of these would be cancer. So it's basically, if you have a chemical that reacts a lot like, well, let's say estrogen, and you are predisposed towards estrogen-related type cancers, it's because of the chemicals that are in the environment, it's being stimulated. And if you stimulate something hard and long enough, it's going to get mad at you and have some deleterious effects. Dr. Lala?
Well, we're coming to the close of this program, and in the next session, we're going to start discussing some natural alternatives. As natural healthcare practitioners, as preventative health practitioners, we're going to look at the natural approaches to it. So I think you're going to find them very interesting, and we're going to do it not from a shotgun basis or just throwing a bunch of stuff out there for you to try, but that you can, with intelligence, find out the internal function of your body, what it needs, what it doesn't need, and then look at some natural alternatives that are safe and potentially effective. So again, remember, maybe you need to look at Jesus at the Great Physician as well. We invite you to welcome him into your heart, or to have his spirit come alive in your body as well. God bless you.
House Call TV has been brought to you by the Fellowship of the Great Physician. For further information, please call at 651-484-8521 or visit our website at www.housecalltv.org. Until next time, thank you for listening to House Call.